Hello and welcome to The Nurse. My name is Belinda, and to give you a little bit of background on myself, I am a former CNA. I am currently licensed as an LPN, and I am licensed as a registered nurse. I hold an associate's degree, a bachelor's degree, and a master's degree in registered nursing. On this channel, we'll discuss nursing issues, problem solving tactics, and ways to deal with different types of patient care. In today's video, we are going to do a case study on the RaDonda Vaught incident that resulted in the death of a patient. The reason I want to do this case study is because it is a perfect example of what I teach as a registered nurse on the job to nurses that are under me and nurses that I supervise. I want to begin by first saying that my heart goes out to the patient, the family, and also RaDonda Vaught. This was a terrible, terrible mistake, and I hope that she is able to get some closure, and I hope the family is able to get some closure. On the agenda today, we're going to discuss RaDonda Vaught's mistake. We're going to discuss nursing license, physician's orders, the 6 rights of medication pass plus 1, orientating a nurse, patient care when administering medications. The reason I say the 6 rights of medication pass plus 1 is because the rights of medication pass has been expanded to include many other factors that deal with passing medications. And so we're going to discuss 6 rights of the medication pass plus 1. Also, in this video, we are going to listen to some of the testimony, or rather one aspect of the testimony that was given during her trial, and that is from the nurse she was orientating, because this is another big factor in this case study of how orientation can go and how orientation should go. First, I want to talk about the nursing process. Nurses should always use the nursing process in the patient's care. That is assessment, diagnosis, plan, intervention, evaluation, and reassessment. So in this case, the nurse should have assessed the situation as well as assessed the patient. She should have diagnosed the situation as well as doing her own diagnosis on the patient, planning when administering the medication, and also planning when going to the patient to administer the medication, which means what are you going to do? Intervention. How are you going to intervene? So you're going to intervene by giving the patient the medication and monitoring the patient and making sure that it is effective. You're going to do an evaluation. You're going to evaluate how you administered the medication you administered, how you administered it, the patient's response to the medication, and if there were any adverse reactions. Then you're going to reassess the situation again to make sure that you did everything completely. Another important aspect of the nursing process is documentation. You want to be able to document. I like to document in real time whenever possible. In this situation, the nurse had plenty of time to document. Let's do some background on the issue at hand. So, Miss Vaught was a help-all nurse, which means she was not dedicated to any group of patients. She was pretty much freestanding, allowed to go to different floors to help different nurses that needed help on their unit with patient care. A patient was due to have a PET scan, and due to anxiety and being claustrophobic, the patient didn't want to go into the machine without having something to relax her and calm her nerves. So the nurse on the floor responsible for the patient notified the physician. The physician gave her a verbal order to give Versed 1 to 2 milligrams. The nurse put the medication in the computer. The pharmacy had to verify the medication, and then it would have taken maybe a few more minutes for the pharmacy to actually input the medication, okay it, and have it on the patient's MAR for administration. And what Rhonda Vaught did was she didn't see the medication pop up under the patient's profile. And rather than wait, she decided to override and manually put the medication in herself. With that being said, eventually she pulled the wrong medication out of the drawer and administered it, and then did not document. So everything that she could have done wrong in this situation, she did it. She did not assess the situation, meaning she didn't say, okay, well, the patient is having anxiety about going in the PET scan. I need to know what time the patient is going into the scan, which means she would have given the tech, she would have called down to the tech room and made plans and made herself aware of the actual time the patient was going to be in the scan, how long the scan was going to take. So she didn't assess the situation. She pulled a medication without a doctor's order. And when I say this because if she did not see the medication on the patient's profile when she went to remove the medication, it meant that the doctor's order had not been placed or had not been there or was not there. So technically, you did not have the doctor's order to pull the medication yet. So she should have waited until the medication showed up on the patient's profile. And this is why I say she should have assessed the situation, because she could have said, well, the patient is not scheduled to actually go into the scan at such a time. The medication has not shown up on her profile yet. So I have some time to wait to make sure that the medication shows up on the profile, meaning that I have a definite doctor's order on the medication and on how much of the medication I'm administering. She ignored all warning labels. So apparently when she typed in the VE, which she should have typed in VER, a medication came up. She punched the first medication she saw, which is a no. She clicked on the medication without actually making sure that it was the medication she was supposed to be pulled. When the drawer popped open, there was a warning label that this was a paralytic. Now, being that she was a nurse on the floor for 3 years now, she should have known the difference between a sedative and a paralytic. Sedative and paralytic have two different meanings. She ignored the warning labels on the actual medication, and in fact, when she pulled this medication, it was in a box with the medication and instructions on how to prepare the medications. She ignored previous experience with the medication. So it said that 21 hours prior to pulling this medication out of the Pyxis, she had pulled the correct medication, which was Versed, out of the pyxis. So my question is, how do you go from the previous day pulling the medication, pulling the right medication, to today, now you're pulling a different medication? She did not do a pre and post assessment of the patient. So, with her being a help all nurse, it meant that this was not actually her patient. So, she had no prior knowledge of this patient. She had no prior knowledge of this patient's vital signs. She hadn't even spoken to the patient. So, she should have done a a pre-assessment on this patient, meaning signs and symptoms, vital signs, patient's complaints. She should have verified with the patient that she in fact needed this medication, because mind you, this was not her patient. So she needed to do a full assessment of everything that was going on with this patient. She should have stayed there and monitored the patient in this machine, because mind you, this is why they called her, because the primary nurse probably did not have that time to stay with that patient and monitor her through this CAT scan process. So with her being free-handed, she had that time to devote to this patient. She did not notify the patient of the name of the drug she was administering. So when the primary nurse got the order for the Versed, she should have gone to the patient and said, ma'am, I was able to get in contact with the physician. He has ordered a dosage of Versed for you, which is going to help you to relax while you're having this PET scan. Okay. Number one, inform the patient so that when a different nurse comes to administer her the medication, the patient can do a self-check of what she is being administered. So when I say she didn't notify the patient of the name of the drug she was administering, she should have gone to the patient. She should have said, hey, listen, my name is Miss Vaught. I'm going to be the nurse in charge of your care while you're in this PET scan. The doctor has ordered a sedative for you. The name of the sedative is Versed. Have you ever heard of Versed before? The patient could have responded, yes, my nurse told me that I was going to get Versed. She should have explained to the patient the signs and symptoms that we want to look out for while I'm giving you this medication. We want to explain to the patient the effects of the medications and what she might be feeling. And then we also want to notify the patient of any adverse reactions we are going to be monitoring for. So what she didn't do was she didn't communicate with the patient. She did not properly assess the patient's complaints of burning during administration of the medication. So being that this nurse had worked with Versed probably many times before, I wonder if she had ever had complaints of a patient burning during the administration of this medication. If not, then this should have been a big warning sign. So it could have been warning signs of a few things. It could have been that the patient was having an adverse reaction to the medication, number one. Number two, it could have been that maybe her IV site was infiltrated. We don't know. So did we do an assessment of the site? Did we flush first? Because when I saw, if you look at the case or the trial, she only had 2 syringes there. She had a syringe of normal saline, and she had a syringe to reconstitute the medication. So you have a syringe of normal saline to reconstitute the medication. You're supposed to also have a flush. You're supposed to have 2 flushes, a pre-flush and a post-flush. You don't flush with the same needle. You don't pre and post flush with the same normal saline. So in order for her to establish that, yes, this line is good, she was supposed to initially flush the line with the normal saline. If the line was good, then when she went to administer the medication, that could have been a telltale sign of, hey, let me stop and check because this patient is complaining of burning. So let me stop and check and make sure this is the right medication, because I don't know Versed to burn when being administered to a patient. She did not stay to monitor the patient during the scan. So you give this patient a sedative. You don't stay around to make sure that the sedative is effective, because according to the case, she administered medication and then she immediately walked away. She didn't stay to make sure if the 1 milligram worked and if the patient may have needed the 2 milligrams. So she was careless in that aspect, because the patient with a 1 milligram possibly did not get enough in order to keep her calm during the entire scan. So being that she didn't stay to monitor the patient, she wasn't able to catch any of the signs and symptoms of this paralytic that she was administering. Okay. She did not report herself to the State Board of Nursing. So, as we all come to know, the incident happened in 2017, and the error by the public was not discovered until 2018, which means this nurse knew that the medication she administered caused the death of a patient, and she did not report that medication error to the State Board of Nursing. Now, usually it's uncommon for nurses to report themselves as making med errors to the State Board of Nursing, especially if the death of the especially if the medication error didn't result in the death of a patient. It's usually handled in-house with maybe some CEUs, or maybe termination, or maybe suspension, or something like that within the facility that you work for. But being that this medication error resulted in the death of a patient, I think she should have immediately turned herself in to the State Board of Nursing once that patient lost their life. Okay. Now, with all this being said, these are all of the signs of an impaired nurse. I'm not going to say how she was impaired. It could have been drug use, it could have been fatigue, burnout, or it could have just been, carelessness. However, whatever the case was, this was clearly an impaired nurse. And this is probably one of the reasons why criminal charges were brought up against this nurse, because you can't just say, oh, she made a med error. Oh, she ignored all of the safeguards that are in place for nurses as far as patient care, medication administration, reporting, all those things. You can't just ignore that and say that this was a nurse that was in control of all her faculties. I mean, who knows? Maybe she was having an out-of-body experience. Maybe orientating another nurse on that day was too much for her, or maybe she had too much on her plate. Now, another thing I want to address is the fact that when she was pulling this medication out of the Pyxis, she and her orientee were discussing a swallow study that they were going to do. Rule number 1. You must be focused on whatever it is you're doing that's right in front of you. There is no way, shape, form, or fashion that you should be drawing up a medication and discussing other issues or other procedures or other patients or any personal things while you are doing something that requires your full attention. And in this case, the medication nor the patient had this nurse's full attention, and nor did either of them have the orientee's full attention. And we're going to talk about that later in this video. Now, I want to discuss when we are granted a nursing license. We are so excited as human beings, as humanitarians, and as people who enjoy helping people. When we go to nursing school, this is the time for us to be learning everything possible about the field that we are going to be entering, because we have people's lives in our hands on a daily basis. So nursing school is no time for play. Nursing school is not to be taken lightly. Nursing school is to have your full and undivided attention whenever possible, meaning when you're at school, you should be at school. When you're studying, you should be studying. When you are dreaming about providing patient care, you should be there in your dreams, dreaming about providing patient care. The RN NCLEX is an exam that tests your competence, which means they're testing your comprehension of what you learned in nursing school. So passing this test is your testimony that you paid attention in class, you are a competent nurse, you know how to delegate, you know how to do patient care, you know how to respond in emergency situations, you know how to administer medications. This is a very, very important exam, and it shouldn't be taken lightly, and we should actually be studying to ensure that we are competent nurses. And then once we do pass our NCLEX and get out there in the field, if you attended a good nursing program, if you took away important aspects of a nursing program, then you should adhere to everything you learned in nursing school when you were out practicing as a nurse. So with that being said, there are a lot of shortcuts that are taken in nursing. However, if you do not know the long way, you should not be doing it the short way. So let's look at physician's orders. Every time I have watched a YouTube video on procedures, how to administer medications, how to start an IV, how to administer IV medications, what is the first thing that a nurse is supposed to do? She is supposed to verify that there is a physician's order, which means, okay, say for example, you're an LPN and you're at work and you have a registered nurse that puts the orders in, and you go to the nurse and you say, ma'am, I have a patient here that's complaining of mild lower back pain, and they have requested that they want to have some Tylenol. And the RN says, okay, yeah, it's okay. Go ahead and give them the Tylenol. Give them, 650 milligrams. I'll make sure that I get a doctor's order for that. What I always tell nurses, no, no, no. You do not administer any medication without seeing a doctor's order. Because if you give that Tylenol and that order is not there, where are you going to document your pre and post assessment, and where are you going to document that you gave this medication? So remember, documenting in real time. You pour, pass, and you sign. In order to do that, you have to actually know how much the doctor says to give. So the nurse may have said, okay, yes, go ahead and give 650 milligrams and I'll get the order. When she calls the doctor might say, oh yeah, I recognize this patient. They have some liver issues. They're probably thinking this in his head. They have some liver issues, so go ahead and give the patient Tylenol 500 milligrams, Q6 hours for mild pain 1 to 3. Now, you've already given this Tylenol. You've already given 650 milligrams. And when you go to sign for this 650 milligrams, what pops up? 500 milligrams. Now you have just overdosed this medication, this patient, number one. And number two, you have given medications without an order. No, no, no. I always tell nurses that I supervise, no, you do not administer any type of medication. I don't care who told you. If the doctor tells you to give it, okay, doctor, I will give it. And you don't have to, be smart or fancy about it. The doctor says, okay, give amoxicillin, 500 milligrams, twice a day for 7 days. You say, okay, doctor, sure. But you wait until you see that order in the computer, or you do not give it, because what if the doctor forgets to tell the RN that he gave this order? Now you have popped open your first dose or your Pyxis, and you have overridden the profile because you don't see the medications there, but you heard the doctor say, or the doctor told you to give the medication, and the order never shows up. Now you have on record that you have administered amoxicillin 500 milligrams. The order never showed up. You didn't document it. You didn't monitor for the patient for adverse reactions, or you could have gave the amoxicillin 500 milligrams. You could have went to the nurse's note. You could have said amoxicillin 500 milligrams administered, patient monitored for signs and symptoms of adverse reactions, none noted, whatever else you document, no complaints of pain, fluids encouraged and tolerated well, blah, 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 blah. And the next day comes, you forget to, re-look for the order and sign for it because you've already given the medication and moved on. So now the next day, the hospitalist is checking the nurse's notes, and they're looking at this amoxicillin order this amoxicillin documentation that you did. You are the only one who has documented, because mind you, the other nurses haven't given it because they didn't see your order for it. So now you're the only one that has documented that you have given this medication. There's no order. There's your license. So it is imperative that you do not administer any medications unless you see a doctor's order and are able to sign for it on your medication mark. That's a teaching moment. Okay, so now we're going to look at the 6 rights of medication, past plus 1. I have put the last 2 below because they didn't give me enough bars for all of them to fit. So the first one is the right patient. Is this the right patient? So during the trial, it was said that RaDonda Vaught went down to the PET scan room and said, is this the Versed patient? That is a clear no-no. Hopefully the patient didn't hear that, because I don't know about you guys, but I would not like to be referred to as the enema patient, or the Norco patient, or the colonoscopy patient, or none of those things. I would like to be referred to as my name, who I am. Is this Belinda? Sure, this is Belinda. Let's go. And now you're going to introduce yourself to me. So number 1, is this the right patient? Number 2, is this the right medication? During the trial, we heard that at no point in time did the nurse verify that she had the right medications. And this is why a physician's order is so important. You have to read every single line of that medication order to verify that it is the right medication, and you are supposed to do this 3 times. So, throughout my nursing career, or what I've learned is that when you open your medication drawer and you pull out the medication, first you look at the doctor's order and you say Versed 1 milligram, 1 to 2 milligrams, times 1 now. So when you pull out that medication, you're supposed to look at the medication and see that it says Versed. Apparently this bottle was going to say Versed 2 milligrams. So you would then look at the MAR again and you would say Versed 1 to 2 milligrams. You will, if it was in pill form, you would pop the pill out in the cup. You would look at the medication again, Versed 2 milligrams. Look at the doctor's order again, Versed 2 milligrams. Then you put the medication away. However you do it, you're at least supposed to do it 3 times to verify that you have the correct medication. In this case, she didn't have a doctor's order. She didn't see a doctor's order. So she should have turned to her orientee and said, hey, I want you to verify this medication with me. Is this Versed 2 milligrams? Her orientee could have possibly said, well, it doesn't say Versed. Do you know, I don't know what Vecuronium is. Do you know what Vecuronium is? And she would have said, Vecuronium? Actually, no. Then you would have went somewhere or wherever they have the resource available for you to look up this medication and say, hey, we can't verify that this is Versed because it doesn't say Versed. We don't know the generic name for it. So let's look it up and make sure it is the correct medication. They could have done a lookup. They didn't do that. She didn't ask her orientee, nor did she even take it upon herself to look up the medication. So therefore, she did not verify that she had the right medication. Is this the right dosage? Throughout my nursing career, before we had the computers, whenever I would come to pass my medications, because as an LPN, I did medication pass. That was my main function on my nursing unit. So what I would do is, if I had 30 patients, I would go in and I will pull every single chart. Yes, I did. It sounds like, oh, no, she didn't. Yes, I did, because I have a photographic memory. I will go and pull every chart. I will flip to the doctor's orders. I would look at the most recent orders that are there compared to when I was there maybe the previous day or my 2 days off. I would look and be like, okay, sometimes I would take notations. Okay, this blood pressure medication was decreased to 20 milligrams. If not, I would just look at it and say, okay, there was a change in order. Pull the next one, do the same thing, look at the orders. Pull the next one, do the same thing, look at the orders. Because when I go to work, I am there to work. I am there to make sure that I do not harm anyone, any patient, any nurse, nor myself. So I made it my business to check those orders on all 30 of those patients. And by golly, I bet you when I hit that cart and I go to administer medications, I would say, oh, no, 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 no. I remember seeing this medication. It was decreased. So what I would do is I would stop, go back to the chart, go to the doctor's orders and say, yep, the order was changed and the nurse did not follow up on the order. So, which means that on this paper MAR, instead of the medication being discontinued and rewritten below or on another page, it wasn't there. So I would have made a medication error because I didn't check. But being that that's the kind of prudent nurse or prudent med pass nurse I checked each and every doctor's orders for every patient I was going to administer medications to. So, is this the right dosage? Now, in that case, in this case, it still says that she gave more medications than she was supposed to give, according to how much medication was left in the syringe. She didn't have the right dosage. She gave a lethal dose of a paralytic. Is this the right reason? This was another medication error that she made. Even though she thought she had Versed, she had Vecuronium, which means that she was giving a paralytic, which means in her mind she was giving it as a sedative, but in all actuality it was being given as a paralytic. Now, I've seen a few videos on YouTube about they use Vecuronium when they're giving lethal injections to death row inmates. I don't like that analogy, or I don't like that they put that out there as a use for this medication, because this medication is used to assist in the intubation of patients. It was on the ICU floor, in the ICU Pyxis. That's where it's supposed to be, because that is the medication that is used on the floor to help intubate patients in ICU. So I don't like the fact that they're saying this medication should have never been available. Why was this medication on the floor? Why this and why that? The medication was on the floor because this is where the medication was supposed to be, because this is the medications that they use to help them intubate patients. Okay? Is this the right time? Now, there may not have been a time. The time could have said now. However, when we go back to assessing the situation of this patient, we have called down to the PET scan tech and we have asked her, what time is the patient going into the PET scan? Oh, well, the patient is going to be going into the PET scan in 20 minutes or in 30 minutes. So then you want to say, hey, this medication only lasts for so and such a time. So I want to make sure I'm down there at least 5 minutes before she is due to go into the scan, which would give you your right time. Because if you're going to give this medication and it's going to wear off in 30 minutes, you don't want to give the medication 30 minutes prior to the patient going into the PET scan, because she's going to regain all her faculties and then she's going to freak out. So that is how you would determine the right time to administer that Versed, that sedative, in order to assist that patient to receive their PET scan. So we have right route. Sometimes, we can't put an order in that says give Cipro 500 milligrams. Okay, give Cipro 500 milligrams. How? Give it PO, give it IV, give it IM, give it sub Q. Give it. How are we giving this medication? So the right route is very important. If you don't have a route, then you have an incomplete order. The right documentation. If you are given a sedative, then you're going to document the sedative effects and any adverse reactions or no adverse reactions. You're going to document the patient's tolerance. You're going to document the site of the IV, how it wasn't infiltrated, how it wasn't tender to touch, it wasn't red, it wasn't swollen, blah, 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 blah. If you're given an antibiotic, you're going to document any side effects or adverse reactions. Side effects meaning nausea, vomiting, diarrhea, or adverse reactions, hives, respiratory distress, or whatever adverse reactions they could possibly have from this medication. So it's important that you document as soon as possible, and you're also documenting on according to the medication that you are giving. So, I mean, we could add so many more rights to this, especially when it's pertaining to specific medications. So, if we're giving, you know, let's say, for example, if we're giving pain medications, you don't want to give a Norco for a pain 1 to 3. That's a mild pain. Usually Norco, depending on the dosage, is given for pain anywhere from 6 to 10. So right pain. So is the pain level right? Is it a 6? If it's a 6, you can give this Norco. Because if it's a 1 or if it's a 2 and you give a Norco, that can be considered as a medication error. So just to give you another example of the rights of a medication pass. The orientation of a nurse. Orientating a nurse. This is where this situation just does not sit right with me. In this situation, there was a whole nother registered nurse there. This wasn't a CNA. This wasn't an LPN. This wasn't a med tech. I mean, it was a whole registered nurse that was standing next to this woman that she was orientating. Right now, I want to take you to the testimony of this nurse she was orientating.
December of 2017, I was being precepted as a new grad nurse. What is that? I was being trained. Is that something you required before you could be out on your own? Yeah. Mm-hmm. And the process. There were several people who were training me at the time. There was some classroom training as well as on the floor. There were several different nurses who were training me. At some yes. And how did that come pass? From what I can recall, I had asked if she could be my preceptor for the majority of the time that I was being trained. And they agreed to that, so we were paired together.
Were you trying to hit that?
Secondly, on December 26th, 2017, recall that day? Yes. What do you recall about the experience you had with Vaught as you were attending to patient trauma? Having a hard time understanding the question. Okay. That day you are yes. Was there a medication to go down to the next? What did you do before we went down? Yeah. As far as what we were doing throughout the day, I don't recall the specifics, but at the time we were getting ready to do some swallow screenings in the emergency room. So a lot of the time in the neuro ICU where I was working at the time, a lot of people would have trouble swallowing, so we would do a bedside swallow screen. At this time, the neuro ICU nurses were the ones who were supposed to be doing them in the ER as well. No, you're fine. So a swallow screen, we would do a bedside swallow screen. It's not the total one that they would do for certain patients, but it was just a quick assessment.
I love to do that bedside swallow screen
for a more in-depth assessment. What's the purpose? So patients don't choke. Yeah. And how long does this screen last? It would take sometimes less than a few minutes, if anything. And on this day, was that a task that you had to complete training orientation? Yes, we had a training packet. And that was one of the requirements on there. We had to cross it off several times. I think 3 to 5. I don't know. So, recall what you and Bob were talking about? I don't recall. Do you recall what she was doing immediately before you went out of that? Immediately before. There were things going on, but we stopped at the Pyxis. She grabbed medication. We went over the swallow screen steps a few times before that, I believe. But
let's go back. I went over the swallow screen many times. There's Vaught.
So from what I remember, so this was kind of it was more a task that was given to RaDonda by Ethan. And what I recall is I was really focused on those swallow screens that were taking, so I was just kind of tagging along for this. So at the Pyxis, she wasn't going over much about the actual medication that we were grabbing. We have worked with the Pyxis before, so she wasn't explaining how she was using it. I don't remember what conversation we were having at that time.
Do you recall which actors you were at?
It was in the middle hallway of the ICU. It would have been around here. Oh. 42. Around there. Several patient rooms next to us. To the right, there was the monitors over here. The supply closet was somewhere over here. Staff restroom. A lot of things going on.
A lot of things going on. So that was roads.
Oh, yeah.
What's along that road?
Along the road, so right here, when I was working there were monitors for all of the front hallway patient rooms that showed all the heart rates and vitals and stuff like that. And then to the right, there were computers that nurses would use to document, and same with to the left there.
Okay. And computers stop.
I mean, they could chart there. They could open the medical records if they weren't directly in front of their rooms.
And at any point when you and Miss Vaught were at the actives, did you see her going to the patient room or anything?
I don't recall.
Did you see her grab some bottles?
I don't recall exactly.
I really need to go to the mailbox today.
Do you recall that she did fixes and kind of walk us through how you access the actives?
From my recollection of that day, I was just kind of standing behind or to the side of her, and I just remember her fiddling around on grabbing the medication, and that's.
Did she say anything to you about what she was doing?
I don't recall.
Do you, at your current role,
I'm an infusion nurse.
you use an active machine?
I don't.
Have you used one since 2017?
No, since I left the ICU, we have a pharmacist on our site, so we don't use Pyxis.
So you're at this active machine. You confirmed that she wrote that as an actual
How did she go
the hatch that's
about pulling? Yeah, she had to search the medication by its name because it wasn't underneath the patient's orders yet. So she searched the medication by name. So when there's when an order is put in for a medication for a patient, it would typically take a few minutes for it to load into the AccuDose there. So if you need it immediately, you would have to do an override and look up the medication itself.
what did she do? Did she do an override?
Yeah.
And did you watch her pull the medication out?
Yeah, but I wasn't paying much attention to it. I remember her pulling it, but
Did you see her look at the medication?
I don't recall. on there, but I believe that's when we went down to PET scan.
And you recall what went on?
Some, yes.
Check patient on.
I don't recall specifically.
Is there anyone else down
there? Yeah. There were some people in the little waiting area, and there was a pet tech as well.
And did you have a conversation with them?
Yeah.
And what was the conversation?
From what I can recall, we just introduced ourselves and asked where the patient was. She was in the kind of hallway of the PET scan place. And just a short conversation with her. I don't remember exactly what it was.
You noticed somebody had her eyes?
I don't recall. I do. She was alert, I believe.
Did she say?
I don't recall.
Miss Vaught say Miss Vaught?
Yes. I don't recall what she said.
How long were you in that sleep period?
I don't recall the exact amount of time, but it was brief. At the bedside, Miss Murphy. Just kind of explained to her what we were doing, asked her her name and birthday, I believe, and I think checked her band as well. I don't recall exactly, but yeah, and then drew up the med and administered the medication.
Did you watch her drop?
I did.
Did you notice the reconstituted?
I did.
Did you have any discussion about the med at that time?
No.
You're being formed into kind of training.
Right.
Is that something that you would have a discussion about? Hey, we do it, how do we do it? How do you usually do this?
Sure. If I hadn't given IV medications before, or even just reconstituted anything before, then maybe that would be a discussion to have, a teaching moment. But I've done those things before, so I think we're a little past that sort of teaching.
I've done those things before.
Okay, so if I know you couldn't hear the questions that were being asked, but you could hear his responses. So my first issue with the orientating of this nurse is that he felt as if when she was called to give this medication, that he had no part in giving the medication, or it was something that was given to her, so therefore he didn't need to fully involve himself. And that is not true. If you are orientating with a help all nurse, then that means everything that she is doing, you are a part of. You should be asking questions. You are there to learn. Everything she is doing, you are supposed to be learning, whether it's on a checkoff sheet or not. Now, when you are orientating, it means that you are supposed to be functioning as a graduate nurse. If there is any aspect of the orientation or the activities that is going on with your trainer, you should be learning and participating in exactly what your trainer is doing. So while she was looking up that verse in the Pyxis, he should have been looking it up with her. He should have been at her side. He should have been saying, well, for me, I would have been like, oh, you just put VEN. Maybe you should put VER, because that would give you a more accurate med list to go from, because you would have the VER. So he should have, soon as that Pyxis drawer opened, he should have been looking as with her. He should have seen the same warning signs as she saw. Warning, paralytic agent. He could have stopped her. He could have said, wow, this is a paralytic. Aren't we given a sedative? Which means he should have known what the doctor's order was. He should have known that it was going to be a sedative that we're giving. Him as a nurse, a registered nurse, should know the difference between a sedative and a paralytic agent. When she pulled the medication, he should have verified it with her. He should have said, wow, Verconium, warning, paralytic. He should have said, oh, we might want to look that one up. Are we sure we're giving a paralytic or are we giving a sedative? So even him as a safeguard, he wasn't a safeguard for her when he should have been. Even when they went downstairs to administer the medication, when she pulled it out of the bottle, she should have handed it to him, and she should have said, see, this is what Versed looks like. Being that he said he doesn't know what Versed looks like, he's never given Versed ever. He's a new nurse or whatever. So she should have given it to him and said, see, this is what Versed looked like. He should have looked at it. He should have been like, wow, look at the top. It says warning, paralytic agent. I mean, so in nursing, 2 heads is better than 1. So another problem I have with this orientation is that he said, oh, I've given IV medications before. So if I would have never given IV medications before, then I would have asked questions. It would have been sort of a teaching moment. But since I've given it, I felt no need to ask questions. Wrong. It doesn't matter how many times you've administered an IV medication. As an orientee, if you have never administered Versed, then you should have been right there learning about the medication Versed that you both are giving. Just because he's an orientee, it didn't absolve him from making sure that that patient was being administered the correct medication, because he is a registered nurse. He is her orientee. Her patient is his patient. Her responsibility is his responsibility. As a registered nurse, you know that you must assess the patient before you do anything. You assess before you give pain medication. You assess the blood pressure before you give blood pressure medications. You assess the effectiveness of antibiotics before you give antibiotics. So if you're giving an antibiotic, you want to make sure that the documentation coincides with the patient's signs and symptoms. My abdomen sort of hurts. I'm having lower back pain. It burns when I pee. So you want to make sure that, yes, this patient needs this antibiotic. Same thing with that Versed. You want to, they both should have, okay, I'm talking kind of fast, but here's the thing. When you're orientating, especially when you're orientating with a help all nurse, this means that you are not orientating with a primary nurse that is responsible for a number of patients. So what happens is, when you're with a primary nurse, you pretty much learn that each patient you go to that you have taken report on and that you are responsible for, you have to do a pre-assessment on each and every one of your patients so that it becomes routine. You get your report, you make rounds on your patient, an initial round to make sure all your patients are alive. Then when you're going to start your medications, when you're going to start any procedures, you do an assessment. So before you administer medications, you want to do an assessment. Before you administer wound care, you want to do an assessment. When you're doing wound care, you want to assess the wound. You want to assess drainage. You want to assess erythemia, which means redness. You want to assess swelling. You want to assess what the wound looks like. Is it beefy red? Is there yellow slough? Is there necrotic tissue? You want to assess everything before you do wound care and put that dressing over that wound. And you want to have your documentation ready to go and document after you have done your procedures. You want to document after you have done your medication administration pass. So just because he was with a help all nurse, this did not absolve him or the trainer on assessing each and every patient that they helped with before they did any type of procedures or before they passed any type of medications. This is why I have a problem with this orientation, because it seemed very relaxed. It didn't seem as if the orientation was being taken seriously. For me, it doesn't matter how many times I've done an IV medication. I'm going to be fully involved with the administration of an IV medication because, hey, maybe this nurse does it better than I do. Maybe this nurse is going to be able to give me some tips. Maybe she's going to bring things to the forefront of my mind as far as administering IV medications. So I have a serious problem with his testimony and how he doesn't recall this, he doesn't recall that. At one point he doesn't recall what she said to the patient, but then he remembers that they introduced themselves to the patient, checked the name band, asked the name, and ask the date of birth. So on 1 minute you don't recall what she said to the patient, but then the next minute you remember that, she asked the name and date of birth. Even though she did not ask him to verify this medication, he should have been gung-ho to verify that medication with her, because of the simple fact that they didn't get it from a clear doctor's order, a written doctor's order. And number two, all of those warning signs that were all over the place. And number three, the fact that she was unable to scan the patient's name band and scan the medication to make sure that that medication coincided with the patient and what she was supposed to be giving. So like I said, I'll say it again, I have a serious problem with this orientation. It was too relaxed, and I don't think that she was attracted to him or he was attracted to her. I think that he wanted her because she wasn't stuck, or not, I don't want to say stuck. She wasn't the primary nurse for a number of patients, which means he wasn't going to have to be doing repetitive things all day long, assessing, diagnosing, intervening, planning, documenting. He wasn't going to have to do any vital signs if they did vital signs. He wasn't going to have to do those repetitive things all day long for 6 to 8 patients. So he wanted to be fancy, footloose, and free with RaDonda because her position was a fancy, footloose, and free position to where she's running all over. Now, another aspect to that is that he could have just wanted to be with her because she was able to go to different areas of the hospital and learn different things. However, he didn't seem as if that was the reason, because anything that she was doing, he was supposed to be involved in. And she may have not minded being his preceptor because he didn't ask too many questions. He just stood by and let her lead and tell him what she thought he needed to know, or she was just going to do his checkoffs, and it was easy. So, for me, when I orientate, sometimes I would have to, when I'm being orientated, sometimes I would have to take control of my own orientation, which means I have had several orientations, because I've been a nurse for almost 30 years now. I have had several orientations to where a nurse that was orientating me wanted to pour the medications and then hand it to me and tell me to go give it to a patient that I don't know. I will have to simply say, no, I'm sorry, I cannot give that medication because you poured it, which means you need to pass it. Of course, they would get a little attitude and be like, oh my gosh, she's lazy, she don't want to pass meds. No, that's not it. I will do the next one, which means I will pour pass and then sign for what I've done and for what I've given. I want to verify my patient. I want to verify that these medications are correct, because this is the correct thing to do. Now, throughout my career, I've done some staffing. I've done some assistant director of nursing. I've, done many functions as a nurse. And so I rarely, and I want to say rarely, stray from my nursing teaching and from what I teach. I do not administer medications I did not pass. That is rule number 1, because you can kill somebody. Number two, I do not orientate nurses in the wrong way. I want to make sure that when you hit that floor by yourself, that people are impressed with how you are doing your job, which means they're going to look back at me as the trainer. So if you are doing a sucky job on the floor, what do they always go back to? Your orientation. It is not enough that you are a licensed nurse. Oh, well, I got my license, so I'm competent. I must be. No, it's not enough, because there are so many aspects of the nursing field that we do not get completely trained on, that we have never touched upon, that, like a lot of us, we've never inserted a PICC line. A lot of RNs have never inserted a PICC line. A lot of nurses, we aren't qualified to insert a PICC line. We aren't qualified to insert a midline. Some of us don't even know how to start IVs. Some of us don't know how to do a lot of things if we've never done them before. This is why I say, when you are getting orientated, I don't care if you've administered IV medications 50 times. Each time, there's an opportunity to closely watch another nurse do a procedure that you have done 50 times. Take it. I don't care how many times you have passed medications. You verify, you pour, you pass, and you sign. Never have I ever passed a whole bunch of medications to a whole bunch of patients and then sign for my medications after I've done my entire med pass. No. So I have a huge problem with the way this nurse was being orientated, the way he carried himself during orientation, and the relaxed way that they both carried themselves. And as a help all nurse and as a preceptor, you are supposed to be doing things by the book. Because when you let this nurse off on the floor by themselves, they should know how this hospital does things by the book. So nursing is to be taken seriously. When you're at work, you're supposed to be at work. There are so many different resources available if you don't know how to do something. If you've forgotten how to all the steps in putting in an IV, there's multiple YouTube videos that can show you that. There should be nurses on the floor that can assist you. I mean, all different types of things. When you're at work, you should be at work. When you're orientating, everything your trainer is doing, you are supposed to be a part of. Now, I wanted to discuss patient care when administering medications. So I've touched on some things in a previous slide, but here you always do a pre and a post assessment of your patients, and possibly reassess them in midstream. So when I say this, I mean this. Say, for example, you have to pass medications to 26 patients. So you have given multiple blood pressure pills. You have given multiple pain pills. You have given multiple Ativans, Xanaxes, and different types of muscle relaxers and things like this, things of that nature. So what we are supposed to be doing as nurses is, once we are done with our med pass, we are supposed to go back and do a round on all of our patients. So, which means you're at room 1, you've given medications all the way to room 26. Well, you're at room 26. So once you're done with room 26, you park your cart and then you go back to room number 1 and you start looking in on each one of those patients that you've given medications to. Make sure they're okay. Make sure they aren't having diabetic reactions to their medications. Make sure they aren't having hypotension. Make sure that the medications that you gave for hypertension, any PRNs, make sure they were effective, which means that you should be retaking their blood pressure. You want to make sure that the patients you gave sedatives to, they're not on the floor. and they're not trying to ambulate by themselves. You want to make sure that the pain medicines you've given in the last 45 minutes to an hour were effective. That's your post assessment of your pain medication, so you can document. You want to, these are some of the things you want to do after you have completed your medication pass. Then you want to, go on about your day and basically do the same thing again at 12 noon when you pass your meds. If you work a 12-hour shift, you want to make sure that you do those things at 6 p.m. after you pass your 5 p.m. meds, or whatever your medication times are. You want to make sure you're always doing a post assessment on your patients. Now, in this instance, like I said, this nurse did not use the nursing process. She didn't assess the situation. She didn't assess the patient. She didn't plan properly. She didn't diagnose properly, because she should have gone down there and done her own assessment. She should have done her own diagnosis, or confirmed the diagnosis that was given. Anxiety, due to claustrophobia, or due to being in small spaces, or due to the length of time patient would be inside the PET scan. Planning. She didn't plan properly. Okay, we're going to give this Versed. We're going to first, we're going to take these vital signs. We're going to make sure that the respiratory status is okay. We're going to make sure that oxygen saturation is okay, which means we're going to get a baseline on this patient's vital signs, so that just in case after we administer this medication, we start seeing changes in the respiratory rate, or we start seeing a decline in oxygen saturation, meaning that the patient is not getting enough oxygen, which means it may have been too much of a sedative. So we're going to plan to assess the vital signs. We're going to plan to administer medication. We're going to plan to monitor the patient during the administration of the medication and after the administration of the medication, to make sure that the patient didn't get too much, or to make sure that the patient didn't get too little of this medication. Then we're going to see this patient off into the PET scan machine, making sure that the medication is working, or to make sure that the patient isn't still having anxiety in spite of having, or despite of having this medication, so that, we can document its effectiveness or lack thereof. So then we're going to stay there. Now, I don't know how the hospital does it, but according to this nurse's actions, we know that she administers medications and she runs off. What is the policy of the hospital when administering sedatives as a help-all nurse? Does the policy say you're supposed to stay there with the patient through the entire PET scan? Or does the policy say that you can administer the medication, monitor its effectiveness, see the patient off into the PET scan, maybe stay there for 10 or 15 minutes, then you can go off, but then you need to come back? What does the policy say as far as administering this Versed for a PET scan? Okay. Now, me personally, I don't care what the policy says. I'm going to stay with the patient. I'm going to make sure that that medication is effective. I'm going to make sure that this patient doesn't have any adverse reactions. I want to make sure that this patient has their PET scan done. I want to make sure this patient is safe and stable and in the care of transportation before I leave this patient. Patient care. Caring for your patients is very, very important. In this case, it was what she did was considered patient abandonment. And I think that this was her, I don't know if this was her natural behavior, because like I said, being that she did everything wrong, everything that she could have possibly done wrong, she did. She was impaired. There's no other way to explain what she did that why she did what she did that day. There's no other way to explain it. So you have a lot of nurses that they're saying, oh my God, you guys are actually prosecuting her for making a med error. We make med errors all the time. You're going to make nurses afraid to report med errors. That is not what should be happening as a result of this case. This is not how nurses should be responding. Even though we can't say how nurses should be responding, I'm saying that this is not how competent registered nurses should be responding. That's my story, and I'm sticking to it, and I'm going to tell you why. The reason I say that is because we are going to have many, many, many nurses coming up behind us. And if they hear us respond this way to the death of a patient because of a medication error, we are going to have a lot of nurses not knowing how to take accountability for their actions. And we are going to have a lot of nurses who think that they can bypass warning signs. We're going to have a lot of nurses who think that they do not have to adhere to the rites of medication pass. This is how nurses should be responding to this case. We should hear a multitude of nurses saying, wow, I'm going to tighten up on my nursing. I'm going to stop my shortcuts. I'm going to revert back to my nursing school teaching. I'm going to make sure that I see a doctor's order before I administer any medications. I'm going to make sure I properly address my patients. I'm going to make sure that I properly verify this medication and who this patient is. I'm going to make sure that I know what medications I'm giving. I'm going to make sure I know the signs and symptoms of the side effects and adverse reactions. I'm going to make sure that if this medication requires me to monitor this patient for X amount of time, I'm going to monitor them over that time. The nurses should be saying how they are going to possibly make some changes in their nursing practice. This case should not scare anyone or any nurse out of the nursing field. It should do the opposite. It should make nurses want to be more competent and possibly overcompetent in their nursing duties and patient care. So I'm appalled at hearing how nurses are quitting the nursing field because this nurse was clearly impaired while doing her job, and she had an orientee standing next to her who felt that that patient wasn't his responsibility because he was only an orientee, so he wasn't giving the patient or the situation his full attention either. I'm appalled that we have nurses that are out here saying that I can't say whether she should have been prosecuted or not because I don't know why the state decided to prosecute, but I can tell you one thing. This was an impaired nurse, and probably if it was my decision, I would want to get down to the, only she knows, but I would want to get down to the bottom of why she forgot what Vaught looked like, forgot that it didn't need to be reconstituted. I mean, I don't know what Miss Vaught was thinking, but like I said, my heart goes out to her as a fellow nurse. I feel like as nurses, we need to take our job seriously. We need to take our patient care seriously. We need to maintain professionalism in front of our patients at all times. You know, I'm one that's big on, I don't care how you feel about this patient. If it's negative, don't show that to them. Make sure you stay professional and positive in front of that patient. If you need to air out about some things that you disagree with about this patient, make sure you do it far away from the patient, or even, make sure you're clocked out before you do it. However you do it, don't do it in front of the patient or in front of other staff that don't know you as a fellow nurse. So if you're going down to the pet room and this tech doesn't know you as a nurse, and you're coming in talking about, is this a first aid patient, she's going to be like, oh wow, did this nurse just say this? And this is how her first impression of you is going to be. She's very rude. She doesn't address the patients properly. She's nonchalant about her job. Patient complained that the IV medication was burning. She didn't do anything but start pushing the medication slower. She didn't stop. She didn't recheck the medication. She didn't check the IV site. She didn't do any of the things that she was supposed to do. What kind of nurses does this hospital hire? So, I mean, the actions of one nurse could potentially taint the reputation of the entire facility. So, when we're doing our job, we aren't just doing our jobs for the patients and ourselves, we're also doing the job for the company. So, we need to keep that in mind. And like I said, I expected a different response from the nurses. However, now I will take this into account that before the entire story came out, um nurses, we didn't have a clear understanding of what happened. So maybe their views are different, maybe not. But like I said, if any nurse is talking about leaving the nursing field because they're afraid of being, prosecuted for medication errors and killing a patient, maybe you should leave the nursing field. And I'm not saying that as a negative, I'm saying that as a positive, because if you don't feel like you can tighten up on your nursing skills and you can reevaluate yourself and what you're doing as a nurse and revert back to your nursing teaching, then maybe it's a positive thing that you do leave the nursing field, because we want competent nurses. We want nurses that are accountable for their actions. We want nurses that are willing to reevaluate themselves and possibly do things different or in a better way. We want nurses that are continuing to educate themselves. We want nurses that are asking questions. We want nurses that are continuing to learn. We want nurses that are continuing to grow. We want nurses that are going to give exceptional patient care whenever possible. So if you feel like you can't do that as a nurse, then maybe you should, make your license inactive so that we can start to train nurses to do things the correct way 99.9% of the time, because no one is perfect. So anyway, this was my video, and this is the nurse, and I hope to see everyone in my next video. Thank you for watching. Please give me a thumbs up and subscribe if you like. Thank you.